continue on to the video, just need to be able to take a few seconds of your time. And so we want to be able to ask you a question. Are you looking to gain more referrals for your agency, your home health, your home care, your hospice agency? We want you to be able to join us at our online marketing bootcamp that has over 7.5 hours of training. When you actually watch our bootcamp and join our online marketing bootcamp training, you're going to get a free month access to our 10xpatientreferrals.com. So sign up for a limited time at 10xpatientreferrals.com and enjoy all the content. So let's go ahead and get back to the video that you're currently watching.
Hey everyone, it's Michael here at Home Health Success Academy and 10xpatientreferrals.com. And in this video, what we really want to be able to talk about is how do you actually find the good marketers? Other than that, right, what are the qualities or what are the things that you want to be able to look into them, when you're having that initial interview with these marketers? So those are two good questions to be able to ask. And that's what I want to be able to share with you guys in this particular video. The reason for that is that, we hear a lot of agencies, and we speak to them and they tell us, hey, Michael, we're sick and tired of getting the wrong marketer. This marketer says that, they have experience, yet all of a sudden we hire them, we pay them good, but then all of a sudden they're not producing and we're wasting our money. And, then all of a sudden you'll hear some places they don't want to fire the marketer because, they feel bad. And, they want to give them an opportunity. They want to be able to see, can they grow in their organizations? Those are two things, to look into, right? So let's first discuss, what I do and what I consult with my other agencies and show them what they need to do in order to be able to find the marketers. And then towards the later part of the video, we're going to talk about, what do we want to look for in qualities or other things when we're, looking into that marketer when we have them up front in front of us, right? So first thing, let's go ahead and start where to look for. Some of the best place to look for is, number one is Indeed. Indeed.com is a great place where a lot of people actually will have their resume on board. They're going to be able to, so when they apply for a position, automatically you get their resume right there and then. So the first thing is, you need to be able to create an Indeed account. Of course, you have to create a company account because this is where you're going to be posting your jobs. Okay, so it's a free account, but every time you post for a job posting, then you're going to have to pay every time you post one, right? And so the best way to kind of look around when you are posting a job at Indeed.com is that, just go ahead and do a search for home health marketer and see what everybody else is posting. Now, the truth is this, you do not want to put too much information in your job posting. The reason for that is, the truth is, nobody's going to read the whole thing. Like the way people actually search for jobs in Indeed is they put their job description and then they look and then they just start seeing who's offering it and then they just start posting and sending their resume. That's just a psychological behavior of an average person who's actually looking for a position. Now, Indeed.com is a great place, and there's another one called ZipRecruiter. It's pretty much the same exact setup. But these two websites are places where you can find people that are actually looking for jobs. In addition to Indeed, what you can also do is you can actually search, right? You don't even need to wait for people to apply for your job. You can actually search by keywords and see who has posted, and you can actually try to see if you want to be able to get them. The second thing you can do is you can actually hire job recruiters as well. So there's a lot of companies out there, right, that actually, are temp jobs, or they are pretty much what they call, job hunters for you. So you can pay them a minimal fee, and they only get paid when they find you the right client for you, the right employee. So that's one choice that you can. Now, another thing that we love to do as well is you can also use Facebook, because Facebook you can actually post for jobs availability for you. A lot of people will, have their website, for example, and put a job posting on their website. But the thing though is, if nobody finds your website, how do they know that you have a job available, right? So the goal is to be able to bring in people from Facebook, or LinkedIn is another good place to, to do job postings, and then have them, siphon themselves and funnel themselves into your website that has your job offer. A lot of the questions also is like, hey, Michael, do I put how much we're paying? The truth is you should. But there's two things that we do when we actually post how much they can make. We don't post, we say that there is a base salary of this much, and typically marketers working for us are making this much. So you want to be able to show them the rainbow, show them the heaven part, meaning that they can potentially make six figures with your company, of course, if they produce, okay? So that's what you want to be able to do. Now, in our extensive marketer research training, we actually go even further in deep on what we want to be able to put into that posting. And we do that with a lot of our clients that uses us as a consulting company, okay? So Facebook and LinkedIn is a great place to post jobs because that's where everybody is. How do you get people to see what you want? Well, you go to where they are, and Facebook, LinkedIn is a good place to go to. LinkedIn is more of a business aspect of a setup of a social media. It is a social media company, just like Facebook, but it's just more ideal for business. And the truth is, if you as a company don't even have a Facebook page, you need to start really looking into doing that, especially also your LinkedIn page. The next thing is, ask your staff, ask the people in your office, more likely, somebody in your office who's working in the home health and the home care industry actually works with other companies as well. And that's just how it works. So you have to start looking into that. Ask your staff members, hey, do you know anybody working for another company that is a marketer that's actually doing great? And you ask them and you want to work with them and see what happens from there. Because they may actually be able to recommend somebody for you, which is a good thing to be able to do. So ask your staff members because it's also a great source. I've actually hired a couple marketers because of these recommendations, right? Somebody in my staff knew somebody who's working for another agency and they knew what they were doing. So we asked them to do a quick intro. They came in, we spoke to them, found out what their basic needs are, and we told them this is what we can do for you, and then this is what we can actually even help you even more and improve yourself. Because we have some amazing training that we want to share with you, and if you follow our training, follow our process, and you have a company that's going to back you up really good, then you're going to even succeed even more compared to the other company that you're working for. So that's another one. The next thing is in public, all right? If you are mindful of your environment, of your surroundings, you'll be surprised what you can find. One of the best marketers that I ever hired actually worked at Starbucks. There's a Starbucks that I frequented every day. I was spending a lot of money every month, and so, meaning in Starbucks. I was there in the morning, then I was going to Dunkin' Donuts in the afternoon. So I would go to Starbucks, and there was this barista that was, really personal, was really good with the customers, and you could really see how he was. Early in the morning, and this person was smiling already. This person was bright. This person, and he was a young gentleman. He was actually just getting out of high school. And so I spoke to him, and I said, hey, it seems like you're really good with people. You're a good people person, and and I got to know this person pretty well because I was going there for about 6 months already in that particular Starbucks. And I spoke to him. I said, hey, how much are you making here right now? What's your actually ultimate goal in the next 5 years? And he said, well, what I want to do is I want to go to junior college and I want to save up some money to eventually go to university. And I said, okay, so you're going to plan to do that in the next 5 years, right? He said, yeah. So perfect. So, you're getting paid here in Starbucks. You're probably getting paid $12, $13 an hour. What if I offer you a position? And this is what you're going to do. I'm going to give you the training that you need. I'm going to give you everything that that you're going to be able to use to become successful. And listen, if it doesn't work out for you, you always have Starbucks to come back to because you have a skill. You learn how to be able to, to make coffee really great. You can make a good, latte. You can make a good Americano. You can always come back. What do you think? And he said yes. And this kid, bless him and everything, was able to produce an average of about 30 referrals a month after around 6 months later on. And so it's a matter of being able to give him the tools. And that's one thing that we have at 10xpatientreferrals.com is all the training needed to give to a marketer to give them the idea and the ability to handle themselves when they're out in the field. So you'll be surprised what you actually find in the field. There's nothing wrong, as what they say is like where you try to get somebody from another company. I have nothing against that. Heck, if another agency wants to go after my marketers, let them be. Because the goal for me is I want my team, I want the people working for me to be happy, to be able to have something to look forward to, whether it's within my company or it's within other people's companies if they're willing to provide and pay for them, okay? So in the public, The next thing, also a good place to look for marketers, is actually in your office. You'll be surprised. People working for you, your receptionist, your QA, your quality assurance person, these people know your product. They already know your product. One of the parts when you hire a marketer is you must be able to introduce them to the product first. And for them to be able to sell effectively, for them to be able to market your services, your program, your home care, your home health, your hospice to the public, they first must believe that it's a good product. Because if it's not a good product, guess what? It's going to translate to their presentation because they themselves don't believe in it. And so you want to be able to get them on board to agree that the product is great. And if you have a great product, the team in your office are great people to actually push out there, because that's one less step in training a marketer, is making them believe and let them introduce and know the products. They know the processes of what happens. They already know what are the procedures on how a patient gets admitted, on how a non-medical patient gets, onboarded into your facility. So think about that. In your office at this very moment, there actually might be somebody that would be ideal to market for your company. And so it's all a matter of now showing them the steps when it comes to marketing. So the next one also, this is right here, is the best probably thing ever. It's looking into the mirror. That's right, looking into the mirror. You as a marketer. I know countless owners of companies that will start an agency, but then all of a sudden, they don't want to market. And I agree with that, right? Because they say that I'm not a salesperson. I'm not a marketer. I don't have any experience. And if this is something really eventually you find out, fine. You don't have to. Bring in the people that can. I always tell people, whatever your weakness is, find somebody who's strong at it. Whatever your strengths are, double up on that. Okay? So, but the thing though is, you can't say you're not a marketer unless you actually try. Everybody who gets into sales were at one time novices. They've never sold something before, and they eventually learn how to actually sell. And so this is something that you guys have to start really looking into and say, hey, what can I do at this very moment to learn about sales? That's what 10xpatientreferrals.com does, is it teaches somebody who is not a salesperson to learn the tactics and skills of sale, or it takes somebody who's a current salesperson, a current marketer, and then bring them up to a higher level. So let me tell you guys an example. When I first got into home health, I was not a salesperson. I was a nurse. I'm a nurse. Now, some of you guys might say, well, nurses will be better salespeople. That's not the truth. I know plenty of nurses who should not even try to market. And so you have to understand, it takes a particular person, but first you must provide them with products and information. So when I started marketing for home health, what happened was I had no clue, no idea. And no one was, at that moment, 15, 16 years ago, nobody was training home health marketers. There were no consulting companies. There were no training organizations like ours at this very moment that has a specific training for home health and home care and hospice marketers. So when I was looking around, I would ask other marketers that I met or other companies, and of course, they did not want to share anything because I was a competition. And they're like, we're not sharing our secrets to what we're doing. We're not going to do that. And that was just the truth, right? So you have to really look into that. You really, really, really have to look into that and look into the mirror and say, hey, you know what? I own this company. So if, like I said, look in the mirror, if you're the owner of the company, if you own this company, your job is to actually know about marketing. And if you don't want to market out there, that's perfectly fine, but you have to have an idea of what the processes that needs to be in place, because who's going to monitor your marketers out in the field? Are they doing what they're supposed to be doing, right? So we have a separate video, for example, that talks about how to monitor your marketers, because you need to make sure that you can monitor your marketers. You need to be able to make sure that they're producing. You don't want to wait a month, 2 months, and then analyze and say, hey, we're paying somebody and they're not doing their job, because you just wasted time. You wasted the months, you wasted the money, paying them. And then you have to now waste some time hiring a new marketer, getting them started again. And then that's where it just all ends up. Time starts happening. How many patient referrals you should have been getting if you had the right marketer and gave them the right training, okay? So that's where to look for your marketers. Your Indeed, your ZipRecruiter, Facebook, LinkedIn, looking into your office itself, your staff members looking into your mirror and saying, hey, you should market Michael. Next thing is looking into, as well as asking your staff and of course in the public. So now we're gonna move on to the second part of this whole video training. And we're gonna talk about, well, Michael, what do we look for in a marketer? Okay, so let me share with you several things. Should you hire somebody who is a current experienced marketer, or should you hire somebody who does not have experience as a marketer? Now, the answer to that is two things, right? If I'm going to hire somebody who has no experience in marketing, there's two types. Number one, the person who's a fresh graduate from college with a business marketing degree, for example, or a psychology degree. Those are people that don't have experience in the field, but they went to school. Then maybe potentially that they would be a good hire. The next thing is you may have somebody who is currently in sales, currently in marketing, but they have never dealt in marketing for a home health.
This video is brought to you by MedicationReminderProgram.com. Are you trying to look for that one edge up to be able to get you more referrals or to get new referral sources? Well, that's MedicationReminderProgram.com. If you start offering this for your patients and future patients, you're going to be able to show future referral sources that you're doing something different, that you're providing better services than your competition. The Daily Reminder program goes like this. We will call the patients for you twice a day and remind them to take their medications at 9 o'clock in the morning and at 5 p.m. A top reason for hospitalization of seniors is not taking their medications. So what you're going to be doing here is you're going to be giving them comfort of mind, both family and referral sources. So sign up to MedicationReminderProgram.com right now. There's 3 packages available, but at the very same time, right now, with code 50 off, you can actually get 50% off our Gold plan and the Platinum plan. So just stop by MedicationReminderProgram.com and let us help you get more referrals. Let's go back to the video you're currently watching.
Because home health or home care is a completely different product, okay? Sales and sales, and it's all about selling a product, but first you need to still, no matter what, introduce them to the product. Now, the other part is, do I hire somebody with experience? The problem with hiring experience, and this is coming from my thoughts and my feelings, okay, is this. If a marketer says they have experience, or let's say they're working for another company and then they want to transfer to you and apply to you, my question is this. If they are good at what they do, why are they leaving their current job? Now, I agree that they might maybe want to get paid more and everything like that, but the truth is this, if any marketer is good at what they do, those companies that hire them will do everything they can to please them and make sure that they do not leave. Okay, so typically what I have honestly seen in the past is this, is that marketers who have experience bring in what they call old baggage, meaning they may have certain they may have the idea of what the marketing's about, but at the very same time as they bring in bad habits, old baggage, right? And I want to be able to break that. So for me wise, to be honest, I would rather hire somebody from scratch, somebody with no experience in marketing. Maybe they just graduated, or maybe they have been selling, they're used to getting the no's of people rejecting them, saying, they're busy, they don't have no time. They have that experience because they created scars. Or hiring somebody who maybe is in the industry, like for example, a caregiver, a homemaker, a CNA. I try to stay away from hiring nurses, LPNs or RNs as marketers. And the reason for that is because a lot of them expect to have that minimum payment already. Like, so an RN, if they want to get into sales and marketing, they're going to ask for a minimum payment of, they want to at least get paid what a nurse gets paid right now. So if they're an RN, they want to make $50,000, $45,000, $50,000, $55,000 a year in average as a base salary. And I'm not going to do that because I come from the part of like, show me, don't tell me. For LPNs, it's the same exact thing. They're going to expect, 35, 45 starting, okay? And so for me wise, if I hire a marketer, I always start them off at between 30 to 35,000 base salary, but then giving them an expectation of what are the minimums they need to produce monthly to be able to meet those, okay? To be able to meet that minimum standard. And if they can't do that, I'm going to part ways with them, okay? So that's something I want to be able to make sure that we understand. Now, I have had LPNs, for example, come to me and say, hey, Michael, I know I've been working for you to visit patients and I want to start marketing. And I tell them this. I said, listen, I want to be able to give this to you. If this is something growth that you want to have, I want to be able to provide this for you. And if this is something that you want, we can definitely do this for you. But I also want you to understand that there is a standard that we expect. There is a minimum requirements. Now, if you want to do this, this is what's going to happen. If you can't produce, we will have to let you go. And I just want to be honest that when we let you go, we cannot all of a sudden say, let's just put you back visiting patients. Because when I let go of an employee, I let them go. I don't let them linger around. Okay? So I always tell them that. I said, listen, this is what it goes. Do you want to take this challenge? If you want, I'm going to support you, give you everything you need so that you can help market this company and, create success for yourself. And I've had it where I've had some LPNs market for our company and they did a great job and they produced well. But then I've also had it where I've had LPNs where I've hired and I had to fire them afterwards. They were good at visiting patients, but they were not good at marketing. Okay? So my choice is no experience or some experience, but not in the industry. It's only ones that actually hired somebody who had experience as a marketing, but this came from in my early days and they had some experience. It made it easier for me to train them. But then it took a little bit different tactic in training to get them involved in the process that I have. So like in our, our online marketing bootcamp or in our live marketing bootcamp events, when we share with everybody, our whole marketing process, our whole marketing blueprint, we detailed that and said, this is what we want you to follow. And getting somebody who had a different mindset on marketing for home health to all of a sudden, go on board to what we expect, takes some, has that learning curve, as they may say. So that's why sometimes it's easier to be able to hire somebody who has no idea so that we can get them to get them to be able to subscribe to what we're trying to do. Okay, it's the same exact thing, honestly, for me when it comes to nursing. Hiring nurses, hiring caregivers, the truth is I would rather hire new graduate nursing assistants, new graduate nurses, or inexperienced in home health nurses, for example, to work for me. Because it's easier for them to be able to subscribe to the mantra that we're doing in our company. All right, so that's my thoughts when we're looking for marketers. Next thing is, you want to be able to speak to references, right? So this is really funny that happens a lot. Is that part of the whole hiring process is that you give them an application, they put in their references, but most companies don't even follow up with their references. You need to call the references. And a lot of companies don't want to call the references because they don't want to call them and then give them idea that they're looking into their current marketer. And when they do that, because they don't want that person to all of a sudden pay them higher and then all of a sudden you can't hire them, right? And honestly, I completely agree. I completely see why people think that way. And honestly, that's exactly why for us, we don't even bother hiring people with experience in marketing already. All right. So, but you want to speak to the references and see, hey, are these facts honestly matching up to what this person is saying? Because I've seen parts where people lie in their resume, people lie in their references. Okay. And there's actually a study that almost 90% or more of people's resumes are falsified in some point, some way, somehow. Okay. People want to, kind of grease their profile. Okay. So you want to be able to make sure you look into their references. Next thing is you want to be able to test them. Part of our interview process is we don't just say, hey, tell me about yourself. Tell me what your goals are. All those basic questions when it comes to marketing. When we come in and we want to train them and we want to actually interview them, part of our interview process is putting them on the spot. We put them on the spot, meaning, there's going to be a phone right in the middle of the desk. And what we do is like, let me see your skills. All right, perfect, great. Right here is a phone. Here's a list of 20 places. I need you to get the referral source of this place. If they don't have experience in the home health industry, we'll tell them who we want them to speak to. All right, you want to look for this person. We want you to get their name. We want you to try to set up an appointment. We want you to try to be able to do this. All right. Now, the whole setup for this is not for really them to get that appointment. If they can, mazel tov. But if they can't, that's perfectly fine with us if they can just get the name of that person. The reason for this is we want to see is, do they feel comfortable being on the phone? The why for that is because part of marketing is that they need to be in the phone. They have to be in the phone. They have to know what they're doing, and they have to feel confident. If they have problems with that part, then if we see other good parts in them that we want to hire, that's fine. It just gives us an idea where we need to work on certain parts with them, right? You just don't hire a marketer and send them off. That's what happens a lot with companies, is that, oh, they have experience in sales. Oh, let me just tell them about a product. Here's a brochure, know about it, or go out there and market. No, when you hire a nurse, a caregiver, you onboard them, you train them, you orientate them. So why don't you have an orientation process for your marketers? It's an important thing. We have a lot of agencies that hire us to go ahead and onboard their marketers. We spend a day with them on the phone. We spend a day with them with video chat. We've even arrived to companies into their office and trained their marketers right there and then. We put them through a 2-3 day orientation process. That right there is such an important thing that you guys really need to look into, right? Because the last thing you want is sending your marketers in the field and they're ill prepared. You know, one of the things we've actually done, we've get hired where we actually go in the field with your marketers for a day and see how they do, and we report back to the owners, the administrators, on what they are doing. There's one thing where a person says they can do this, but can they actually do it in the field? Those are two different things. And you as an owner, as an administrator, as a manager, you know, you guys need to go in the field with your marketer sometimes and see what they're doing. And if they're failing in front of you, then guess what? They're failing when you're not around, okay? So you have to make sure that this is being done, all right? The next thing is you want to put them on objection handling skills. Hey, what are you going to say to a doctor when they say they're already working with another agency? You want to be able to role play. You know, part of our training when we actually get hired by companies to manage their marketing team, instead of hiring somebody paying them $70,000 a year to manage the whole marketing team, we get hired for half that price, and every week we'll have role-playing games with these marketers. Hey, if I tell you I'm already busy, or I'm busy, or if I tell you I don't have time to talk to you, or if I tell you that, you know, I'm already working with a home care agency, what are you going to say? Put them on the spot and see how they reply. If they start mumbling, if they start juggling around, can't answer with the fastness, then there's something going on. There could be a difficulty there for you. Because if you put pressure on them right there and then, and they cannot produce, they cannot react, it's going to happen and translate into the field. And that's something that you guys don't want to happen. You don't have time for this. You don't have time for mistakes. Are mistakes going to happen? Of course. But if the basic mistakes are happening, guess what? It's going to happen continuously in the field. The next thing is testing your presentation skills. You're going to say, hey, this is our product. These are services. I'm going to give you 10 minutes of, you have 5 minutes to look into these things. And I just want you to do a quick, 5-minute presentation. Or what you can do is this. I can then tell them how I want them to present it. Give them 5 minutes with the brochure, with the flyer to be able to review our services. And then I'm saying, hey, tell me about it. If they can even do half of what you expect them to do, okay, in that short period of time of not preparing yet or being put in the spot, then you're in a good position. But if they can't even mention the basic services that you guys are offering, then you're going to have a problem. Marketers need to be able to adapt and react on the fly, and they need to be able to handle those type of things. So that's what we want to be able to look for in a marketer when we're interviewing them, when we're meeting them. Now, when you're hiring marketers, it should not be a one interview process. You want to be able to, have a 2 or 3 interview process. Part of the interview process pretty much goes talking to them on the phone for 5 minutes, just knowing a little bit more about them. Second thing is meeting them face to face. And the third thing is to be able to have them come in another time and bring in another person from the staff, right? You want to be able to put them on the spot. Countless times I will hear somebody hire a marketer and all of a sudden, they hire them, they onboard them, then all of a sudden, when it's time to come into work, they don't even show up. So we want to see, are they willing to go through the process, through a phone interview, through a first meeting, and through a second meeting, okay? So that's what you need to be able to do. And just going back again to my preference of not hiring people with experience, I'll be honest with you guys, I would rather not hire people with experience because, like I said, they may bring in old baggage or pretty much just bad juju in your company, okay? And also pay attention to when you're hiring somebody who has experience in the home health industry, the home care industry, you need to ask them one question in addition to everything that you're asking them, is that do they have a non-compete clause, all right? So if you don't understand what a non-compete clause is, send us a message. I'll be glad to be able to talk to you guys about that. But if they have a non-compete clause, then that can cause problems for your company if you end up hiring them. So make sure you have an idea of what's within that non-compete clause that they actually have, okay? So that's my mindset regarding how to look for a marketer and what to look for in a marketer when you are deciding to hire them. If you have any questions, always leave us a message, send us an email, give us a call. I just want to be able to let you guys know our job is to be able to help you guys succeed, right? So 10xpatientreferrals.com, for example, gives you everything you need to be able to help yourself to be better at marketing or to provide training for your marketers that you're hiring. So please take a look at that website, 10xpatientreferrals.com. It's a really great website, and we have a lot of people in that platform at this very moment. Also, if you like this video, don't forget to like it. Please click the like. Don't forget to subscribe to our channel because that's what we're doing here. We want to give you great content. And of course, there's a bell down below in the YouTube channel. Please click that. It's going to notify you when we have new videos such as this that's going to be able to be beneficial for you guys. Home health marketing is easy when you know what you're doing. My name is Michael. Thank you so much.
Hey everyone, we want to be able to invite you to our 10xpatientreferrals.com where we have our online home health marketing academy that's going to be able to help either a home health, home care, or hospice agency increase referrals, increase their census, and create a profitable company. Now, at this very moment, you're going to have access to these information through these training, marketing to physicians, how to get to hospitals, how to be able to get into nursing homes, and much, much more at a month-to-month basis with no contracts needed. It's just month to month. Now, guess what? We are offering you guys for a limited time 50% off any one of our plans. Just choose which one is going to be able to work better for you. So just stop by the 10xpatientreferrals.com at any given moment. So these are the plans that are available, whether it's the gold, the silver, or the platinum plan. Most people go for the gold plan, but it's up to you what's going to work for you. We definitely want to be able to have you come in and work with us. So here's two choices. Go to 10xpatientreferrals.com or click the link down below. Take advantage of this right now at this very moment and sign up with us.